we have been asked, why are we doing communications campaigns when the right intervention is vaccines or medicines or so on? And what I would like to say here is that there's no one single intervention that would make a difference in the pandemic. The pandemic has spread, and we are unlikely to stop the spread or avert the spread of the pandemic. What we need now is to reduce as much as possible, and as much as the knowledge and materials we have allow us, the mortality and morbidity of the pandemic. One of those ways is to deal, as the call of action details, to deal with the excess mortality of pneumonia and severe respiratory infections. Another one is to reduce the spread of the pandemic, and that's exactly what we want to do. That's exactly what we have started doing. We have started doing that in the last days of April in Mexico. We are doing that in more than 30 countries today, and what we intend by releasing the campaign today is to be able to do it in 186 countries. What you have with you is a communications campaign. This is not intended to advertise us or to tell people about what the Red Cross does. This is not an advocacy campaign for us. This is a health intervention, and this has to be seen as such. We are reaching out through our network to all the people at risk. We are reaching out to people who have the means to go on the internet and see a video about it, but we are also reaching out for people who do not have televisions or radios or other means to be able to communicate with. We do that regularly. The Red Cross volunteers of the Red Cross and Red Crescent go on daily basis around the world and disseminate health campaigns. The scale of the influenza has enabled us to coordinate this globally and to provide messages rapidly and hopefully effectively that will reach people who are at higher risk, will reach populations in crowded areas in developing countries, will reach hopefully mothers and that will be able to protect their children, will reach people in refugee camps, people in crisis areas. And those messages, if followed, we feel confident will reduce the transmission of the disease and will reduce the mortality in communities. What we have here is not a message telling people what to do, it's a message telling them that they can decide to protect themselves. It's an individual message, and it's something that doesn't require resources, something that people can do for their own. And it will start being spread